Okay guys, Timmy coming at you here, and today what I'm going to do for you, or try to do for you, is explain to you how the medication Digoxin, digitalis, works in treating heart failure, also in treating arrhythmias. One of the things that when people go into heart failure, they develop atrial fibrillation or atrial flutter. The problem with that is that the SA node is sending out these tons and tons of signals, these electrical impulses, and they're getting through to the ventricles. So if the atrial rate's real high, sometimes you get an uncontrolled ventricular response. So the heart rate becomes, the ventricles contract at a very high heart rate. And you don't want that. And remember, the ventricles are the primary pumps. So what Digoxin does is it slows the electrical conduction system of the heart through that AV node, that branch between the atria and the ventricles. And by slowing the conduction, even though people are in atrial fib, you can slow down the ventricular response. And if you slow the heart rate down, how fast that the ventricles contract, then the ventricles can, when they're relaxed, they have a longer time to relax, so they can add more blood to them. And if you add more blood back to the heart, the ventricles, then you're going to stretch them and they're going to contract harder. So that's how Digoxin works in controlling heart rate, and it also affects the force of contraction of the heart. So a couple of terms you got to be familiar with, and one thing that you absolutely have to know is that the most important element in muscular contraction, regardless of the muscle that you're talking about, in this case the heart, is calcium. And in the heart, the myocardium, it relies on calcium from the blood to contract. So anything that decreases the amount of calcium in heart muscle is going to affect the force of contraction of the heart. So if people have congestive heart failure and their ventricles aren't contracting really hard, you don't want to decrease the amount of calcium in that poorly contracting heart. Otherwise, the failure becomes worse. So that's why calcium channel blockers in a dilated congestive heart failure, where the heart is stretched out and it's contracting weakly, calcium channel blockers are contraindicated. So one of the medications that they can use is the medication Digoxin. So to understand how it works, again, the devil is in the details, so we got to start talking to you again at the cellular level. So if you look here, I made a really lovely drawing of a heart cell. How do you know it's a heart cell? Because I wrote heart gel, but now it's a heart cell. So this is a heart muscle cell, and again, that you basically have two types of cells in the heart. You have cells that will conduct electrical impulses, and then you have cells that will contract. So I'm going to kind of combine the two just for simplicity. Otherwise, we'll get a little bit goofy. All right, so here we go. You got your heart cell, and then embedded in the cell membrane are these little protein ion channels. You also have our buddy, our pal, the one and only sodium-potassium pump. What the sodium-potassium pump does is it pumps sodium and potassium. You should write that down. So let's talk about this a little bit. First of all, sodium is highly concentrated in the blood. Potassium is highly concentrated in the cell. And for the sake of the heart, I'm going to tell you that calcium is highly concentrated in the blood. Now, these ions can't simply willy-nilly go through the cell membrane of the heart cell and get into or out of the heart cell. They have to go through specific protein ion channels that are embedded in the cell membrane. So sodium can only go through a sodium ion channel. Potassium can only go through a potassium ion channel. And of course, calcium can only go through a calcium ion channel. And they always follow their concentration gradient. But you also learned that the inside of the heart cell, the charge is negative, and the outside is positive. And the reason for that is really twofold. One Potassium is much more permeable than sodium or calcium. So how I like to explain it is this. Timmy's the blood, and you are the inside of the cell. So maybe we should do this. Maybe it'll help you. That every time you come into class, I give you $2. I give you a sodium dollar and a calcium dollar. And every time you leave class, you give Timmy $100 back. Well, at the end of the semester, Timmy's going to be positive and you're going to be negative. So potassium is much more permeable than sodium or calcium. So potassium is going to leave the heart cell faster, more readily than sodium or calcium is going to enter. So if you give positive things away, then you become negative. So this is what allows the inside of the cell to become negative and the outside to become positive. The other thing that helps maintain and reestablish the charge inside a heart cell is our buddy, our pal, the sodium-potassium pump. And the sodium-potassium pump takes 3 sodiums that leaked in. Now, a bunch of sodium is going to leak in, but when 3 sodiums leak in, it's going to take those sodiums and it's going to bind those sodiums, 3 of them, to these little seats on the sodium-potassium pump. So sodium is going to bind there. And at the same time, remember, potassium is leaking out. So a bunch of potassium is leaking out, but the pump will take 2 potassiums that leaked out, right? And they're going to take a little seat on the sodium-potassium pump. And then what the pump does, through using ATP, right, because you're going against the concentration gradient, it will pump against the concentration gradient. It will pump the 3 sodiums out that leaked in, and it will take 2 potassiums that leaked out and pump them back into the cell. So this is what helps maintain that charge, that resting membrane potential inside the cell, and it also helps reestablish it. And because you're going against the concentration gradient, this requires ATP. Now, how digoxin works. Let me get rid of some of this stuff first. So, how digoxin works is this. Digoxin binds, that medicine binds to the potassium sites on the sodium-potassium pump. So if you're taking digoxin, instead of potassium binding there, digoxin is going to bind there. And when digoxin binds there, very important, it inhibits, it stops the sodium-potassium pump. Now, how's that going to help the heart? Well, let's look. If you've inhibited the sodium-potassium pump because you've taken digoxin, and remember that digoxin, the drug, binds to the potassium sites on the sodium-potassium pump, and then it essentially stops the pump from working. But look, you still have sodium from the blood leaking in through a leak channel. You have potassium from the cell leaking out through a leak channel. And you have calcium leaking in. Now look, if it's still leaking in, sodium's leaking in, you got to get that sodium out of that cell. You have to get it out because you learned that when sodium moves, water will follow it, and it will cause the heart cell to swell and it will blow up, right? That's bad for you. So embedded in the cells, the heart cells, is a little protein exchanger, and it's called the sodium calcium exchanger. Now, as the sodium builds up inside the cell, so the sodium is going to start to build up inside the cell because you're not pumping it out because you took DIG and it inhibits the sodium-potassium pump. You got to somehow get that sodium out. So as the sodium builds up, it's going to activate this little protein exchanger in the cell membrane of heart cells. And how it works is it will exchange 3 sodiums that got into the cell and get it out into the blood. And it will exchange it for 1 calcium in the blood, and it will go into the cell. So you're removing the sodium and you're getting more calcium back into the heart. What did I tell you the first thing? Calcium is the most important element in muscular contraction, and the myocardium, the heart muscle, relies on calcium from the blood to contract. So by inhibiting the sodium-potassium pump, what you do is you allow more calcium into the heart cells. And if you allow more calcium into the heart cells, it will contract harder. So that is why DIG, that's a bad color, digoxin, is referred to as a positive inotropic agent. It increases the force of contraction of the heart. And then when somebody's in heart failure, that's exactly what you want to happen. So more calcium's available, the heart will contract harder. The other thing is that digoxin increases the effect of the vagus nerve. So if you recall from anatomy and physiology, your autonomic nervous system, you have the parasympathetic nervous system, and then you have the sympathetic nervous system, right? The sympathetic nervous system increases heart rate. The parasympathetic, and specifically the vagus nerve, cranial nerve number 10, that will slow your heart rate. And it does so by slowing the conduction of the SA node through the AV node. So that essentially slows your heart rate. So because it slows your heart rate, digoxin, it is referred to as a negative chronotropic agent. Now, because of digoxin's effect on the AV node and slowing the heart rate, and you learn this in clinical, that the therapeutic dose and the toxic dose of digoxin is very, very close, then that's why you have to monitor a patient's pulse for 1 full minute. One of the things that can happen in people who are on digoxin heart failure is they lose the effect of the atria, essentially decreasing the filling of the ventricles. It's an atrial fib. So you have to take the apical pulse for a minute, because if the heart rate is irregular, right, and you feel it for only 15 or 20 seconds, you may get a heart rate that is too high or a heart rate that is too low. And one of the effects of digoxin is to lower the heart rate because of increased vagal stimulation to the heart. So that's why you take it for a full minute to make sure that that heart rate is not less than 60. If it is less than 60, then you talk to your doctor as to whether or not they want you to hold that drug or not. And that's the reason for taking the pulse for a full minute. Now, a couple of other considerations with digoxin. First of all, the half-life of digoxin is pretty long. What that means is that in order to get a therapeutic level in the blood, you have to load the patient. So you have to give them relatively large amounts of digoxin for the first several days in order to get a therapeutic blood level. Once you have loaded them, then they can go on maintenance dose. The other thing you have to know about digoxin is and again, it's important if you understand the mechanism of action, right? It's not that hard. Remember that digoxin competes for the potassium binding sites on the sodium-potassium pump. So if your blood level of potassium is low, right? You have a low blood level of potassium. That will allow digoxin to bind to more of those potassium sites on the sodium-potassium pump. So that's why a low level of potassium can lead to digitalis toxicity. That's why when a patient is on digoxin and they're changing their doses, either increasing or decreasing, you have to monitor their potassium levels as well. The other thing is that digoxin increases calcium into the heart. So if their calcium levels are high in the blood, more calcium will go into the heart cells. And now you're taking digoxin, which is going to allow more calcium into the heart cells. So that can increase the toxic effects of digitalis. So you got to monitor these electrolytes, but most specifically and most routinely, that potassium level is going to be monitored. And in people with heart failure, they're typically on a diuretic like a Lasix, which loses potassium. That's why it's very, very important to keep your eye on the potassium when you're giving patients digoxin. So, little video on digoxin. Hope it helped, made sense.